Hello YouTube, this is Kiaz Maina. Welcome back to my YouTube channel. This is a health and lifestyle channel where we talk about different health conditions and lifestyle modifications to accommodate the same. Karibuni. If you're new here, subscribe. If you're not, welcome back. And if you're not new and you've not subscribed, subscribe as well. So today's topic is ectopic pregnancy, which basically means an extrauterine pregnancy. Extrauterine pregnancy means that it's a pregnancy that has not implanted itself in the uterus, as ideally it should. See, when an ovum is fertilized, it should go and implant itself in the uterus, where it grows to term and it's delivered into a baby. Now, sometimes this fails to happen, and the ovum that is fertilized implant itself commonly in the fallopian tube, which we call tubal pregnancy, and sometimes it may even implant itself outside of the uterus into the peritoneal cavity or the abdominal, so we may call that abdominal ectopic pregnancy. So yes, what causes ectopic pregnancies? The number one thing that causes ectopic pregnancies is hormonal factors or hormonal imbalance. And at this juncture, I would like to say, if you have hormonal issues, it's good to see your gyna or your doctor to get advice and to get treated for the same, to avoid such and such complications. Another thing that may cause you to have an ectopic pregnancy is genetic deformities or even birth defects. That also can cause you to have an ectopic pregnancy. Another thing is a medical condition that is affecting the shape of your uterus and the structure of the uterus and the fallopian tubes as well. If you have such a medical condition, again, it may cause you to have an ectopic pregnancy. Finally, if there is inflammation or scarring following a medical condition, infections, or even a surgery, it may cause you again to have an ectopic pregnancy. Sawa. So after the causes, let me talk about the risk factors, because they are quite close-knit, and you might see me repeating myself from the causes, because they quite kind of intermarry themselves. So the number one risk factor would be, if you've had multiple previous abortions, there's a likelihood that you may find yourself with an ectopic pregnancy. Number two, if you are on an IUD, ngoja kidogo. We've done a series on family planning, so we've talked about the IUD, tubal ligation, hizo vitu zote, but leo na mention mbili peke yake, tubal ligation and IUD. If you're on either of those two family planning methods and you conceive, the pregnancy may being the operative word here, the pregnancy may end up being an ectopic pregnancy, okay? Another risk factor would be, if you've had a previous ectopic pregnancy, there's a possibility of having another ectopic pregnancy as well. And then if you conception by use of fertility drugs, again, not all, but there is also a slight chance. Again, kumbuka tunasema hizi ni risk factors, si ati ni lazima, but they kind of put you at risk as well. Maternal age above 35 years of age, again, that is another risk factor. And then if you have a history of STDs, STDs as well. STDs ndio hizo infections nilikuwa naongelelea pale kwa causes. So if you have a history of STDs, and STDs can be very recurrent. Again, let me pause again and tell you that I have done a video on STIs and UTIs as well. Go back and watch it. Yeah. Ujua the different kinds and the difference between the UTIs and STIs. So if you have a history of UTIs, don't worry. But if you have a history of, if you have a history of UTIs, don't worry. But if you have a history of STIs, there is cause for worry kidogo. And then if you have a history of PID is pelvic inflammatory disease, or even endometriosis. Endometriosis is a condition of the endometrial lining or the inner lining of the uterine wall. If you have those two conditions, again, there is a very high likelihood that you may have an ectopic pregnancy. Alright, nadhani tuko pamoja mpaka hapo. Now the next thing I'll talk about is the signs and symptoms. Na hizi ni kidogo because the number one thing is pain, and the first pain you're going to experience is a severe sort of pain on your abdomen, and then the other kind of pain you may experience is mild-ish, and it comes in waves. Now the abdominal pain may be constant and very severe and sharp. Patients I've seen with this kind of pain are in quite some pain, and they may even assume a position yenye unaona kweli kweli wako na uchungu. You may even crawl. But the other pain I'm talking about of your pelvic region, you may have shoulder pain, neck pain. It comes in waves. It may be severe or not, but it comes in waves. But here, tumbo, the abdominal one, it's a bit severe. The second symptom is vaginal spotting or bleeding. And the third one is dizziness, and you might faint. Now, this one, I don't know if it's a symptom or it's something to consider. If you've missed your period, it is a symptom. You need to, if you've missed your period and now you're experiencing these symptoms, the symptoms that I've mentioned above, you need to check and see. Okay? So how do we diagnose or investigate ectopic pregnancy? Now, the confirmatory test is an ultrasound, a pelvic ultrasound. The sonographer will do an ultrasound for you on exactly where this pregnancy has implanted itself, and then from there kutaenda vile kutaenda. Other investigations that may be done, number one, a pregnancy test will be done. Your doctor may also want to do a test we call full hemogram. Atataka kuangalia damu yako, if there is any infection, or if the levels of your blood are okay. Yeah, basically investigations si nyingi sana, but the number one basic and confirmatory is a pelvic ultrasound, an ultrasound rather. It doesn't necessarily have to be a pelvic one. I said pelvic because the commonest ectopic pregnancy we have is tubal, and the tubal is part of the pelvic organ, so it's a pelvic ultrasound. But you can have generally an abdominal ultrasound if we are suspecting your ovum has implanted elsewhere in your abdomen. Sawa sawa. So after that, let me talk about treatment. Kuna treatment options mbili. One is medical, one is surgical. Medical, it comes in an injection form, and you're injected with a drug that prevents the cells from continuing to divide and multiply. So it kind of kills. It's in a limit na inaua. It just discontinues the kuendelea kuishia hiyo embryo, because it's usually bado haijafika kukua fetus. It just limits the growth of that embryo, and now you check it out as if you're having a miscarriage. And how this goes on is you will have bleeding, vaginal bleeding. You may cramp, you will cramp, and you may pass some tissues. Haitakuwa damu tu kama ile ya period. It will have some tissues in it. So that's how that might end up. The other option is surgery. Yeah, surgery ni surgery. Tunaenda theater, they check out what they need to check out. Yeah, maisha inasonga. Okay? So, caution or prevention. Number one, caution or prevention. Niliwaambia caution na prevention zinakuanga now the opposite of the risk factors. So we are just going to go back into the risk factors and tuone. Number one, some of these factors are hard to, it's impossible for us to prevent ourselves from them, to be cautious or even prevent ourselves from now something like ectopic pregnancy. Lakini kuna vitu zingine tunaweza fanya. Like for example, tulisema ile point ya multiple abortions. use a family planning methods to avoid abortions. You see, things like that. Now hizo ndio vitu tunaweza, you can do something about. Hizi zingine tunaachia Mungu, ni fate, lakini it's something you can do something about. Just do. Okay, another thing we said, if you have an IUD in situ and you conceive, so you need to keep checking every 6 to 12 months. You check the position of your IUD. IUD ni coil. You check the position to avoid, if you conceive, isiende kwenye haifai kukua, because you see, ideally the IUD inakuanga imeingia kwa uterus, so kama imejidetach kidogo and then you get pregnant, it may not have enough space to attach itself in the uterus, so itasonga huko kwenye fallopian tube attach huko again. You see, so you need to check your IUD very frequently. Use condoms and reduce the number of sexual partners you have. Hiyo ni point ya STDs. STDs, STI, same thing. Yes, so use condoms and reduce the number of sexual partners you have. Just take care of yourself generally. Yeah, I think those are the only things we can do something about. So be cautious about that, prevent yourself. Yeah, and I just think we are done. Thank you for watching. Remember to subscribe. See you next time. Cheers.